Hello students, welcome back to Easy Nurse, where nursing education made easy. So today we are Easy Nurse here for your community health nursing live session. So mainly in this session we are going to discuss regarding some important topic. Mainly this chapter we are going to focus on the unit 2. Okay, so let's start about the today's session. First is working with the families in relation to prevention of the disease and promotion of the health. So as a healthcare workers, while we are going for the home visiting or in a community health worker purpose, so that time obviously we have to communicate with the families. Otherwise, if we are not getting the proper response or proper cooperativeness from the family members, so whether we will be able to provide the proper care to the family members? No, right? So that's why before planning or before implementing our planning for any families, we have to first plan how to communicate with the families. Okay, so let's say working with the families, which involves the assessing, planning, implementing and then evaluating the care, which is mainly supporting the health and then well-being of the family. So family as a unit of the whole, which is rather than focusing solely on the individual patient. So we have to focus each and every person of that particular family members as a individually. Okay, so while we are going for the family visit or home visit, so that time we have to go for the assess. Based on the assessment or based on the history or data, we have to plan how we are going to provide the proper care to that particular patients. Okay, so based on that we have to do the planning, and based on that planning we have to implement it properly as maintaining the proper guidelines and proper time hour. Okay, so what will happen, the effectiveness of the treatment plan will be more for that particular patient as a individually in that particular family, and they will be very helpful from our care side. Okay, so now come to the importance, why this importance is needed for with the families. Okay, first is the support systems. Families, they are providing mainly physical, emotional and then the social support or well-being to the family members during their illness as well as the recovery time. Next is the healthy behaviors. So family, they are mainly habits and they are practicing the greatly influence healthy behaviors and then outcomes. Next is the coping mechanism. So coping mechanism is nothing but family, they are often play a crucial role in helping the members cope with the health challenges. Sometimes what happens, especially for the adult boys or girls, if they are gone for any kind of the disease, as example the prostate cancer or the testis cancer, so that time obviously the shape of their body is going to be changed and they can't able to accept that particular situation at that same time. So that time as a family members, they are all obviously they will give their proper guidance as well as emotional support to accept of that particular situation and cope up from that particular situation. So that's why family is one of the most important component while we are going to provide the proper care to any kind of any patients. Next is the holistic care. So mainly holistic care is nothing but like collaborative care. From each and every aspect of view, we have to provide the care. So while we are going to provide all aspects of views care, so that time obviously we need the support from the family, right? So that's why addressing the family needs, which ensure more the comprehensive and effective the healthcare illness. Now come to the disease prevention. So as we know, disease prevention are having three phases: primary, secondary and tertiary. So primary prevention is nothing but health promotion as well as disease prevention. Means before entering that particular microorganism or any kind of the substance which is mainly affecting our health, so before entering, what are the precautions we are taking? So that is called primary prevention. So primary prevention, they mainly focus on the prevention of onset of disease by promoting the healthy behaviors. Okay, so what is the intervention? Health educations based on the balanced nutrition and then regular physical activity. So if we were going to get the proper healthy diet as a regular basis, so that time what will happen, our each and every system, especially the gastrointestinal system, our gut health will be very healthy. So if our gut health and intestinal system or gastrointestinal system will be healthy, healthy, obviously other system is going to be healthy. Okay, so that's why we have to mainly focus on the health education regarding the balanced nutrition. Next is the promoting the immunization for all the family members, as example measles. Next, we have to educate the family members for the self-hygienic practice like hand washing as well as the food safety. Next, we have to provide the family counseling on the stress management and then mental well-being. Next, we have to advocate for the smoke-free homes and then environment. Next, come to the secondary prevention or the early detection phase. Means at a before some times or before some days that particular substance or organism is entered into the body, but onset till now didn't start or somehow it's going to be started. Okay, so that phase, if we are taking or if we are detecting that phase, means we can able to manage that particular disease, or we can the person, there is a chance to be cured from that particular disease. So that is called secondary prevention. So for this secondary prevention, what is the main focus? Detection the disease early to prevent any kind of the complication. Next, come to the intervention. So what are the intervention? First, screening for the common disease, as example hypertension, diabetes, cancer, etc. Then we have to conduct the health assessment and early diagnostic test for the family members at the risk, and we have to educate the families, which is mainly recognize the early signs of illness like respiratory infections. And we also have to assist the family in scheduling the routine checkup and then diagnostic service. So if we are keep the patients in a routine checkup or diagnostic service, so what will happen? Obviously, if any kind of the disease progression is going on inside of the system, also we can able to know. Next one is the tertiary prevention or managing the chronic condition. Means already this onset started and symptoms also started to coming out, so those time is called as a tertiary period. So at that time, how we have to prevent? We can't prevent, mainly we have to focus on the managing the symptoms as well as the palliative care. That's all. So mainly the focus is reduce the impact of the disease by supporting the family care efforts. So now come to the intervention. First, we have to educate the families on the chronic disease like insulin administration for the diabetes. What are the places are there where we can inject the insulin? How much unit we have to provide? What are the things we have to do before insulin administration, after insulin administration, when we have to take this insulin? So all the studies, all the information we have to give to the patient. Next, counseling the families on the coping strategy for the caregiving roles. Next, we have to provide the support for the rehabilitation activities as well as the lifestyle modification. Means modification in the sense like healthy lifestyle habit, we have to inform the patient to be started. So what will happen if anything is happening due to this lifestyle changes, that will be covered up. Next, we have to connect the families with the specialized services and support groups. Next, come to the care of sick in the home. So for the sick person in the home, how we are going to provide the care? So caring for the sick individual at home, it is a very essential aspect for the community health nurses, which are mainly focus on providing the supportive, preventive and then therapeutic care, which is mainly ensuring the patient's recovery while they're going to improving the quality of that life particular patients. Okay, so now come to the objectives. First is comfortable environment for the recovery. Means which environment, in which room we are going to provide that particular patient's care, that room should be eco-friendly with that particular patient. Next, we have to promote the faster healing, which is mainly offering the personalized care. Next one is we have to educate the family members about the proper caregiving techniques. So proper caregiving techniques in the sense like which medicine we have to give, how we have to give that particular medicine, okay, how much dose we have to give. After providing medicine, what are the things we have to observe, whether any complications are coming or not. So this kind of information and education, if we are going to provide to the particular family members, so obviously they can able to cope up with that particular any emergency situation. Next one is prevent the complication and reduce the need for the hospitalization. So if as a healthcare workers or as a family members, well, they are going to provide the care, if they're finding any complications, so as per the information, they have to immediately ship the patient in a hospital. Okay, next come to the support the emotional and then psychological well-being for the patient and family. So now come to the nurse's role in the home care. So as a nurse, what should be our role while we are going to provide the patient care in any particular patient's home? So first is the assessment. So what are the things we have to assess? We have to evaluate the patient's conditions, what are the things patient is needed, as well as a living environment, means eco-friendly environment. So mainly we have to identify the potential health risk as well as the caregiving challenges. Next one is the planning. So we have to develop a care plan which is tailored to the patient specific needs. Okay. Suppose one patient is a diabetes and she or he gone for the diabetic foot surgery. Okay, so based on the diabetic foot surgery, we have to plan the care like treatment plan, and based on that we have to provide the intervention. So that intervention only we are going to implement in that particular day of the caring giving time. Okay, so that and the things we have to maintain it, and we have to set the achievable health goals which is mainly collaborative with the family, because without the family we can't achieve the proper setup health goals, means we can't achieve that goal. Okay, so now come to the implementation. So we have to provide the necessary treatments, as example wound care, as example the dressings or medication administration, etc. Then we have to assist the patients with the activities of daily living, as example bathing or feeding or anything. Then we have to ensure the patient is maintaining the proper hygiene, as well as family members are also maintaining the proper hygiene. So what will happen? It will be helpful to prevent the cross connections or cross matching of the infection from one person to another person. And as well as we also have to look up on this like regarding the clean living environment. Then we have to educate the family especially on the disease management and caregiving techniques. So as example the hypertension patient. So for the hypertension patient, what are the diet we have to give? That is dash diet, right? So what is dash diet? What are the components should be present? How much percentage should be present? What are the things we have to keep in the diet as a less amount? So all the information if we are going to provide the family, means obviously they can able to manage the hypertension of that particular patients. Okay, so based on that we have to implement our plan. Next is the monitoring and evaluation. So regularly we have to put the patient as in a checkup for improvement or signs of any kind of complications. Next we have to reassess the care plans, which is mainly based on the patient's progress. So based on the patient's progression we have to make a one care plan per day and we have to implement it. So what is happened? Next, provide the emotional support for both the patient and then family members. So these are all the nursing role for the home care patients. Next one is the care of the physically handicapped. So if a person is physically handicapped, so as a nurse what should be our role? So caring for the physically handicapped individuals which all are requiring the holistic and then comprehensive approach, which is mainly ensuring their well-being, independence and then interactions with the society or with the social factors. Okay, so that is the mainly handicap patients care. So who are handicapped, obviously the society they are not ready to accept those person easily, right? So as a healthcare workers we have to engage them, we have to influence them to provide a proper holistic and then comprehensive approach which will be helpful to improve their emotional well-being. It will be helpful to improve their independency as well as integrations or the communications in the society. Okay, so now come to the objectives. So what are the objectives of that particular patient's care? We have to promote the independence and then self-reliance of that particular patients. How? By providing the proper emotional support, physical support, as well as to influence them to interact with the community people. We have to improve the physical, emotional and social well-being of that particular patient. We have to support for the rehabilitation as well as adaptations of the daily life activities. We have to help the patients to do the daily living activities, as well as at the same time we have to influence them to do their own work and their own hand. Okay, so next we have to prevent the complications due to the immobility or the limited physical function. So now come to the components. What are the components of care? First is the physical care and support. So we have to assist with the activities of the daily living such as bathing, dressing as well as the feeding. Next we have to encourage the regular physical exercise or the rehabilitation therapy or the physiotherapy, which will be helps to maintain the mobility of that particular patient as well as the bone health. So we have to use the assistive device for those patients who can't able to walk, as example wheelchair, braces, walkers, prosthetics, etc., as per their patient's need. And also we have to ensure a clean and safe environment to prevent the injury and then falls. So next one is the rehabilitation services. So in this we have to improve the physiotherapy, which will be help to maintain the strength and then immobility of that patient. Occupational therapy also we have to implement to teach the techniques for the daily task, and we have to also implement the speech therapy for those with the communication difficulties, and orthopedic as well as the prosthetic support when the patient is required. Orthopedic in the sense based on the bone, or for the any upper extremities as well as the lower extremities. And then prosthetic in the sense like suppose one patient and is blind, they can't able to see, so for them another eye transplantation if it is needed. So based on the patient's need we can go for this. So that is called prosthetic. If the patient can able to hear, means one machine we can insert into the patient's ear so the patient can able to hear. So these kind of things are called a prosthetic. Okay, so now come to the psychological as well as the emotional support. So for them what we have to do, we have to provide the counseling to address the feelings of isolation, depression or the anxiety. So if the person, if we are keeping the person as a isolated, obviously the patient will get the anxiety, depression, irritation inside of their mind. So because they can't able to speak up with any kind of the person, right? So that's why we have to ensure it. The patient should not be keep any kind of the isolating phases except with the any kind of serious communicable and non-communicable disease. Next we have to foster the self-esteem and then confidence, which is which will be very positive reinforcement vibes it will come. Okay, then you have to encourage the participation in the social as well as the recreational activity. So what will happen, based on that the improve strength also going to be improved for that patient, and patient is also will be trying to do something especially on their daily living activities. Next one is the educational and then vocational support. So we have to facilitate the educations by arranging the accessible learning environments. Sometimes for the patient who can't able to see or who are a blind patient, for this studying we can provide some alphabets. So by touching, they with the sensation they can able to understand what is the actual structure of that particular letter. So like this we have to engaging them, and also we have to give for the vocational training, which is be very helpful to developing the job related skills for that particular patients. And career counseling also one of the most important for identify the suitable employment opportunities. Mainly in our nursing field, what is happening, especially in the first year, you can see, right, some people they are joining in the nursing, and after some months or after some years they can't able to continue up, right? So that time what is happening, they are quit up in that particular course in middle and they are going up. Okay, so like this, why they have to why they should be stand in particular one point, what is the main scope of the nursing. So this kind of counseling if we are going to give for the students, so obviously they can able to think before taking any kind of the wrong step. Next one is the social integration. So social integration is nothing but encourage the community involvement and then participations, especially in a social events. And also we have to promote the acceptance and then reducing the stigma in the society, because for the handicapped patients they are not ready to accept, they're thinking sometimes myth and sometimes they are believe. Okay, so that kind of stigma we have to delete from that society. Next we have to support the advocacy for the disability rights and then accessibility. Next is the family involvement and then education. So we also have to educate the family members about the disability and then care requirements. What are the care they have to give for that particular disabled person based on the patient's need. We have to provide the emotional support for the caregivers and stress management strategies, because compared to the patient who all are going to give the the care, means caregiver, either family members or like home nurse or whatever, they are only mainly getting the more stress compared to the patient. Okay, so for them also stress relieving strategy is needed, right? So that also we have to implement, and also we have to encourage the family participations while we are planning the care to provide the patients. Okay, next one is the prevention of the complications. So we have to monitor for the pressure source in the individual to like limited the mobility, so especially in the bedridden patient who can't able to move. Okay, so for this there is a chance to get the bed sore, okay, or the pressure ulcer. So what are the management, everything we have to tell the family members. Next we have to maintain the proper body alignment, which will be mainly help to prevent the joint deformities. Sometimes what is happened, based on the patient's comfort zone, we are giving the particular position to the patient. Okay, but due to this the deformities, what is happened, joint structure is going to be restructured. Okay, so from normal to the abnormal, so these kind of things we have to prevent it. Next we have to provide the nutritional care, which will be mainly helpful to prevent the malnutrition as well as the weight related issues, and also we have to ensure the good hygiene practice to prevent the infection. So now come to the role of nurse in the care. So what is the nurse's role as a, especially as a community health nurse? So we have to conduct the comprehensive assessment of the physical as well as emotional needs. We have to develop the individualized care plan, which is mainly collaboration with the hospital and family as well as the patient, and also we have to educate the individually and then caregiver on the assistive device as well as the self-care techniques. As a nurse only we are, if we are thinking about the patient, it should not be done. About us also we have to think, because if we are not safe, obviously we can't able to provide the treatment. So we have to monitor the progress and provide the referral for the specialized care when it is needed. So now come to the care of mentally challenged person. So individual who are mentally challenged, they mainly require the patient-centered care, supportive care as well as a multidisciplinary approach. Okay, which are these kind of the three components, they mainly focus on enhancing their independence, dignity as well as the quality of the life. So what are the objectives? First is promote the mental, physical and social well-being. They have to enhance the individual's functional abilities as well as the independency, especially on their own categories. Then we also have to ensure a safe and supportive environment. We also have to prevent the complications which is related to the behavioral as well as the emotional disturbances, and also we have to provide the education and emotional support with the families as well as the caregivers. So now come to the components of the care for that particular physically challenged, mentally challenged person. First is the physical care and health maintenance. So we have to monitor the general health, ensure regular the medical checkup, means the patient should be keep on regular medical checkup as well as a diagnostic service. Then we have to maintain the personal hygiene, and that also helpful to encourage the participation in a self-care activities. And also we have to provide a well-balanced diet, which is mainly help to meet the nutritional needs based on the patient's health requirements. And also we have to ensure the regular physical activity, which will be helpful to improve the motor functions and overall health. Next is the emotional as well as the psychological health or the support. So we have to provide the reassurance and then emotional support to the family members, which will be helpful to build the self-esteem power as well as reduce the anxiety or depression. So we have to use a positive reinforcement, which will be mainly encourageable for the particular patients to prevent the desirable behaviors, and also we have to ensure the routines to reduce the stress and promote the stability by engaging them in other kind of the activities. Next one is the behavioral management. They have to identify and manage the triggers for the disruptive behaviors, and also we have to use the reward based strategies for the behavior modifications and maintain a calm or structured environment for the patient. Next one is the educational and cognitive stimulation. So for that we have to provide the access to special education, which is mainly tailored based on the individual needs, and also we have to encourage the patients for the cognitive activities such as puzzles, memory games, then simple problem solving tasks. So what will happen, their mind will be diverted into this and they will not be feeling any kind of the discomfort. Next we have to use the visual aids or the simple instruction, which will be like more facilitating them to engaging in the kind of like education. Next is the social integration and communication. So for this we have to encourage the participations in in a group activities process and then social interaction. We have to support the development of the communication skills through the speech therapy if it is needed, and also we have to promote the friendships as well as the relationship with the community. Means social interaction it should be done. Next is the vocational thinking and skill development. So for that we also have to offer the training for the simple repetitive job task which will be matched with the individual's abilities, and also we have to assess in finding the supported employment opportunity where it is possible. Now come to the role of nurse in the care. So we have to conduct the assessment for identifying the cognitive as well as the emotional needs of that particular patient. We have to develop the individualized care plans which will be mainly tailored for the personal capabilities. Also we have to provide the educations on the medication management and behavioral interventions. Also we have to coordinate with the therapist, educators, social workers for providing the comprehensive care or the collaborative care, and also we have to offer the guidance and counseling for both the individual and family. Now come to the surveillance and monitoring. So what is the surveillance? It is nothing but it is a systematic collection, analysis, interpretation as well as the disseminations of the health data. So what are the data we are collecting while we are going for the home visit? So after collection of the data we have to analyze it, then we have to disseminate it. Based on that we have to take the decisions and we have to provide the care, and based on that we have to implement our care plan. So that is called surveillance, and after implementation of the plan also we have to go for the evaluation whether it is going to be effective or not. Now come to the types of the surveillance. First is the active, means health officials they are actively seek informations by conducting the healthcare providers as well as conducting the field investigation. As example, survey for the disease outbreak like dengue. Next one is the passive surveillance, means healthcare providers they are mainly reporting the cases to the health authorities voluntarily. As example, the routine reporting of the tuberculosis cases by the clinics. Next one is the sentinel surveillance. Select the healthcare facilities monitor the specific disease to identify the trends. As example, they are tracking the influenza trends to the designed hospital. Next one is the syndromic surveillance. Is nothing but they have to monitor the symptoms rather than confirmed cases, which will be mainly help to detect the outbreaks earlier phase. As example, monitoring the respiratory complaints during the flu season. Next is the objectives of the surveillance. First, detect the cases outbreaks early, monitor the disease trends and then health outcomes. Then also you have to evaluate the effectiveness of the control program, identify at the risk population and health determinations, as well as also we have to guide the resource allocation and then policy making strategy. Now come to the monitoring. So what is the monitoring? Mainly it involves the routine and continuous observation, measurement as well as the evaluations on the specific health programs or the disease condition, which will be mainly helpful to assess the progress towards the set goal. So what is the types of monitoring? First is the process monitoring. They'll mainly focus on the activities as well as the resource utilization. What are the resources are there as a hospital or in a PAC? So based on that, how much we can able to monitor the patient's problem. So that is called process monitoring. So as example, monitor the number of the vaccination administered. Next one is the outcome monitoring. So mainly assess the results of impact of the intervention. As example, reductions of the malaria cases after insecticide distribution. Next one is the impact monitoring. They are mainly evaluating the long-term effect on the health status. So as example, they are mainly decline in the child mortality rates due to the immunization campaigns. Next one is the key aspect of monitoring. They are mainly tracking the progress in disease prevention and control the activities. They are evaluating the effectiveness of the interventions and they are ensuring the resources as being used efficiently. Now come to the importance of the surveillance and monitoring. What are the importance? First, early detection of the health threats and then timely response. Second one, identifying the emerging health trends and the risk factor. Third one, assessing the impact of the health policy as well as intervention. And fourth one, strengthening the disease prevention and then control strategy. Now come to the role of community health nurse in a surveillance and monitoring. First, community health nurse, they have to play a crucial role for maintaining and improving the public health status by actively participating in the disease surveillance as well as the health programs and monitoring. So mainly their responsibility is focus on contributions of the early detections, effective controlness as well as prevention of the disease within the community. So first is the roles and responsibility. First, data collections and reporting. So we have to identify and record the data from the family as well as the community or PAC or any hospital settings, and based on that we have to report to the higher authority. Then we have to gather the data on the maternal and child health, nutrition and immunization coverage. Then we also have to maintain the accuracy as well as the timely records for the health surveillance system, and based on that data we have to report this health events to the public health authorities, which will be followed by the national guidelines. Next is the early detections of the disease and outbreaks. Okay, so first we have to recognize usual the disease patterns as well as the symptoms and which are the like age category they are mainly going to be affected. Then we have to monitor the early warning signs of the disease outbreak, such as the clusters of the similar cases, and also we have to conduct the field investigation properly, which will be mainly collaborative with the public health teams. Next is the health education and awareness. So we have to educate the community health people about the disease prevention, management, then symptoms, transmission and preventive measures. Then also we have to promote the health practices such as vaccination, sanitation, hygiene, etc. Then also we have to encourage the community participations for the disease reporting and then prevention efforts. Next one is the immunization and screening program. So we have to administer the vaccine for each and every age group of people. Then also we have to conduct the mass screening for the disease like tuberculosis, hypertension, diabetes, and also we have to track the immunization coverage rates and ensure the follow-up. Next one is the monitor the health program. So for that we have to evaluate the effectiveness and impact of the health interventions in the community settings. We have to collect and assess the data on program implementation and outcomes, and also we have to identify the gaps in service and recommend the improvement. Next one is the case investigation and conduct the tracing. For that we have to conduct the case investigations for the communicable disease, as example the COVID-19. Then we have to trace the conduct of infected individuals and ensure the proper follow-up entrance as well as the isolation or shifting the patient to the hospital. Then also we have to provide the health counseling and preventive care to expose the individuals. Okay. So thank you. I hope you all understood my session. Again we'll meet in next session. Till that, keep learning and stay tuned with the Easy Nurse. Thank you.